So, as you can see on the slide, so I'm Hossein Khalili. I'm the director for Center for Interprofessional Practice and Education at the University of Wisconsin-Madison in the US, and also happens to be the president for Interprofessional Research.Global. It's a global research network that are really looking into interprofessional collaboration or interdisciplinary collaborations between different healthcare providers and healthcare professionals. So, and the talk for this hour is just through harnessing on the power of resiliency as well as innovation and collaboration when it comes to the transformation of healthcare education and practice during the post-COVID transitions. Let me see, okay, I'm not sure if this slide doesn't work. Oh, okay. So we know, as was mentioned in the morning as well, COVID-19 was a real shock to not just to practice or to society, also to education as well. In a matter of days, so we saw that more than 1.5 billion students were affected. Either they had to go into online virtual education, or quite a number of those may have suffered not having educations for quite some time. So you can see on the slides, even before COVID, the poverty in the learning poverty rate in some low and middle income country was 53%. With the COVID, majority affected much more significantly, specifically in Africa and some other parts of the world. For 6 to even a year, some of the schools were closed. Even at the university, you can see 30 to 70% of higher educations were postponed or canceled, which was very significant, specifically if you look at the healthcare education. So at the time that we needed the students to learn more about how to deal with these situations, and could have been a wonderful experience for students to be in practice, quite a number of those clinical training were affected. You can see, again, this COVID pandemic was unprecedented at the time. Some decision needs to be made even a matter of a day or two. So, again, when we look at what happened for the education, specifically health professional education, again, you can see the two trends. One, the transitions to online that was quite successful in some countries. For example, in countries that they had the infrastructures to quickly transition to online, it was a very good transitions. In other parts of the world, it was not that easy. And when it comes to health professional, we know health professional educations from medicine, nursing, and others are hands-on education. So which means they need to be at bedside, they need to do some of the procedures and practices at the bedside with the patient and others. With canceling or not allowing students to go to practice, to clinical, then they would lose valuable educational opportunity. And we started to hear from practice side, so some of the graduates in the past year or so may not have all the skills and knowledge and competence that's needed to be practicing as a doctor, as a nurse, as a pharmacist, and others. So we'll see, we're still going to see more and learning more about the impact. And the other important piece, again, by transitioning to online and canceling, this education, how prepared the future generation of healthcare provider would be to handle and address this type of crisis. Even if you look at the past 2 years and how the previous or the current healthcare providers were ready to handle or to deal with COVID, you can see these are some of the quotes from healthcare providers at New York. So we know New York was hit very seriously early on with the COVID hit. So majority of those doctors, again, majority of the healthcare providers that were interviewed were physicians, were nurses, pharmacists, and others. You can see almost all, they say they were not ready. They didn't expect such situation happen, and they did not have the knowledge and the skills. So, and that's quite significant. And what could have been some of the impact or the consequences of not being ready to handle that load of patients, plus the transitions to online, we can see that some of the magnitude is still to be determined, but as some of you for sure, you are aware, burnout is something very serious. So based on some of the studies, about 80% of healthcare providers and close to 70% of students, they felt some level of burnout during the pandemic, and still some continuing to have some of those anxiety and stress due to different factors. And for sure, this healthcare was not prepared in any way. Nobody expected, but at the same time, the amount of unpreparedness was significant. Some better stuff could have happened. The other one, as you can see, the transitions to the telehealth happened, quickly, and healthcare providers need to be able to, handle and be ready to utilize telehealth in the best ability. Patients' access to internet during the COVID is we expected. Telehealth was another issue in some parts of the US, and I'm sure some other countries. We heard yesterday and also today that access to computer and internet is not common for everyone. Based on some stats, 60% of the population have access to computer, but 50% would not or do not have regular access to internet. So that's really affecting not just the students or healthcare providers, or service users is really affected by this level of inequity in access. And digital divide was worsening. So again, if you go beyond just the healthcare, when everything is online and 50% of the population do not have access to regular internet, their impact or the impact on their job security and many others would be significant as well. We know, for example, when it comes to diversity and inclusion, we know majority of people who had to continue working during the COVID were those who in lower social economic status, that they got COVID and affected much more seriously. So again, I don't want to repeat in terms of the impact on education, but it was significant. And even if we look not just in healthcare, currently, for example, in US and Canada, we are hearing that the students, primary and K-12 students, are lagging behind in math, in science, and some other basic science educations, considering the COVID impact and the long time virtual learning that was essential, but at the same time was not quite effective. So through the InterprofessionalResearch.Global, we, due to the large amount of burnout and others, we developed at the global level a discussion paper on building resilience in healthcare. What is unique about this publication, and also we had a publications part of this, what is unique about this publication and the way that we know this resiliency is from a system level perspective. We cannot just blame healthcare providers to be resilient if the healthcare system failed them in terms of even equipments, even workload and others. So if we look at the resiliency from a system perspective, so system as the largest scale needs to be prepared for this organizational level resiliency, then team resiliency and individuals. So I have a couple of slides on these components. You can see individual resiliency is something that we have been working on this for a long time, but team resilience is other piece. We know during the COVID, if there were not the team to support healthcare providers, many of them even could not have survived for even a week of that workload and others. So as physicians, nurses, and others were staying in hotels and others even for weeks without going home, just not affecting their family and others. With having the team there support them, really they managed to go through. So the team resiliency is very crucial that we need to pay further attention. When it comes to organization and system, again, system needs to expect and be prepared for unexpected situation. And these unexpected situations, so it could come at any point. And how the system and the organizations could be resilient in many different ways. So again, I refer to the discussion paper that we published. But generally speaking, we know this. For example, some of the hospitals were not able to generate revenue based on, their system of, payment model and also the way that they were, structures. So that really impact not just the hospitals, also other healthcare providers or other patients who needed regular care, but they were not able to get to the hospital and have the elective surgery and others. So there could be, in a better way that could be addressed. Diversity, we just talked about those. So again, those are the two main issue, and the service fragmentation. So again, that's some things that we, for example, in US, the whole of government approach were used. So we noticed, for example, as been discussed in the past couple of days, in a matter of a year, we managed to have the vaccine available to all. So that was not easy. It's really every component of the government, every component of the healthcare and society needs to come together. So that's the way that would help with the resiliency as well. And we know, COVID and similar pandemics are, at the same time that is crisis and cause lots of problem, at the same time bring some opportunities, silver lining, when it comes to, these type of situations. For example, Isaac Newton, many of his discovery came during the time of pandemic, during the plague in UK. So again, with the force, closed down and everything, sometimes people might have more time to do their research and their thinking and their insight and others as well. So what was some of the silver lining, in terms for the COVID and healthcare? Again, telehealth was some things that, at least based on my understanding and my involvement in US as well as Canada, for decades we're trying to bring telehealth to the forefront. However, the policy, regulations, funding, and others were a barrier. But COVID hit, and telehealth became the only way to provide access to services and care for majority. So this is still an issue that needs to be further evolved, but some things as a silver lining. And for students, so we know that clinical training was canceled. However, students sometimes have had the opportunity to go to the community, and with the vaccinations, with the COVID testing, and many others, they had some exposures and some opportunities to be trained as well. So again, really is about time that we can reflect and see what else we can do to further improve healthcare transformations in the next decades or so. Healthcare in Crossroads. So sometimes we can see this COVID as a temporary situation that caused some disruptions, and we can go back to normal. But the other way that we could see, this is an opportunity that we can sustain and integrate some of those great silver lining for future as well. So really is important, to prepare the next generations for, the 21st century of healthcare system. So the healthcare system is changing significantly. We have seen, significant movement and paradigm shift from profession-centric to patient-centered, and what's the needs of patients and population to address. From practitioner autonomy to team collaboration. So healthcare is not a function of one profession, rather all different health professionals need to come together to provide care and services. Rather than focusing on illness and cure, really health promotions and prevention would be essential. Involving patient is the other piece that is very important, to engage them and empower them for the care and curative. And acute and episodic care needs to be replaced by chronic care management. You can see on this slide, maybe I can go to the next slide and come back to the previous one if I can. For example, chronic diseases in the US, you can see 90% of healthcare expenses go to healthcare, to chronic disease management. However, the total number of people is not significant, but at the same time, nearly 30 million Americans are living with chronic disease, not just one or two, some of them with 5 or more chronic diseases. And that's really, costing the healthcare system significantly. And if I go back to the previous slide, this one, you see healthcare or clinical care is only 20%, counts towards 20% of the health outcome. 80% of the health outcomes is related to social determinant of health and health promotion. So maybe a health system and healthcare systems needs to really transition in that perspective as well. And the funding, for healthcare and healthcare education and healthcare practice could be modified in this regard as well. So, mentions in terms of the healthcare cost. We know in some countries the healthcare cost is not, significant compared to the GDP, but in U.S., Canada, and some others, the healthcare is almost 16 to 18% of the GDP. In 2020, $4 trillion was the cost of healthcare in the U.S. So which is very significant. If we look at other countries, you can see U.S. is 2 to 3 times higher than average of the Commonwealth countries when it comes to GDP. And the question is, if we are spending so much, would the quality match with the total spending or not? So this slide shows, for example, if you look at the U.S., U.S. ranks last. So is last when it comes to quality of care and services. In other words, while spending much, much more than many others, however, the quality of care and services is not the level that we expected or it should be. And some of medical errors is significant. You can see here more than 250,000 of deaths in hospitals are avoidable. If we have better communication, better collaboration across different professions, some of those deaths could be reduced. Or communication failures is significant. There are 30% of malpractice in healthcare is affected by those communication failure across different professions and programs working in healthcare. So the other piece I'm going to emphasize is the technology. Technology, COVID shows us that many of these technology are functional and could be very essential to be utilized to better access, to better quality and others. How we could use, those technology and innovation is going to really change or break, make it or break, the next generation or the next 10 to 2 years of evolvement and advancement in healthcare. So everyone has, some devices, either through their phones, their watch, and others, that they can check their health and health status and others. How much those being utilized part of the healthcare system? Not significantly. We are still focusing on large hospitals and large equipments and others. However, some technology, with your phone, you can do, Doppler, you can do lots of great, tests and others with the small devices. So how those could be utilized is also very important. So innovation here, so healthcare needs to really benefit from these opportunities that's available for the group. So some of changes in healthcare is not easy. Healthcare is complex and really affect everyone and in many different ways. So some of the works that could be implemented to utilize agile methodology. I know sometimes rather than making a plan for changing everything to reach to the best outcome, we can start small and continue and see what are some of the progress that we can see. Digital technology, I just mentioned, some of the changes and some of the great research that are happening really provide the base for low-risk transformation in healthcare education and practice. And a couple of other items on the slide as well. So incorporating virtual education and practice, part of everyday practice and education is going to be essential. So it mentions about, health professional education and remodeling. I know, for example, interprofessional, interdisciplinary collaboration between the healthcare team has been highlighted from WHO, World Health Organizations, and is still very important. Sometimes it's still students, graduates, when it got into practice, they may not be quite ready to do the works that they need to do. More collaboration between those is needed. Interprofessional collaborative practice, again, valuing the contribution of every healthcare providers in the team is as essential as others as well. Pedagogy needs to change. If we are going to teach some of the skills through virtual simulation and others, so it's better for us to have a better understanding how to evaluate those competencies, those skills when it comes to those virtual opportunities. Or if we are utilizing telehealth for healthcare practice, then there could be more criteria and more readiness from healthcare providers as well. Content and competency is the other piece. So we know healthcare, again, as we saw, current generation of healthcare providers didn't feel that they were ready for COVID. What about the new generations? Are they ready? Maybe there are more needs for incorporating pandemic preparedness, crisis management and others into the curriculum. Resilience is huge. So if we do not pay attention to the resilience of healthcare providers and healthcare system, it could affect later on. So it's very important to incorporate those. And digital divide is real. So the other day was mentioned, if we want sustainable development at the global level, so we need to, in healthcare and other fields, to pay attention. Whatever we do through the technology, we could make it available to the rest of the world. And sometimes it shouldn't really cost other countries or healthcare providers in other countries with lower social economic status and others to pay in order to access the knowledge and information. So it should be more accessible for everyone. And I think, we recently published another discussion paper on transformations of healthcare education and practice in post-COVID era with a focus on collaboration as well. We'll further discuss that in the virtual simulation, telehealth, virtual education, and others. And lastly, again, partnership is crucial, and this conference, shows interdisciplinary and interagency, between countries collaboration is very essential, not just for research, also for education and practice when it comes to new technology and new advancements. And we know the future of healthcare really relies on how we can overcome some of the challenges and barriers that we're talking about, in terms of the post-COVID, and it requires all of us to do the work that we need to do. And sometimes change, again, back to the change is not easy. Sometimes we see resistance in healthcare education and others. And this graph shows that before we get into the bottom of the change cycle, is better, to provide new directions and new guidance in order to bring people from shock to, relief of anxiety. And that will help in terms of time, in terms of effort, in terms of speed and everything. So that's one other message that I want to share. The other piece is, perfection is the disease of progress and advancements. Rather than looking for making everything perfect before making changes, is better to look at excellence. So if you look at excellence, so rather than being fear of failing, we would open to a new opportunity to take some risk and move forward with the opportunity. Rather than being judgmental, we would be more open and also accepting of different perspectives when it comes to different ways of doing work. Rather than always taking people's time and energy and others, we would provide more opportunity for people to grow. And also, rather than being in control to make sure that everything goes based on the plan, we would be more open to go based on the flow. It's good to have a plan, but at the same time, COVID shows being ready for unexpected situation is the win, and adaptability and flexibility are essential. So with that, I'm going to just end the conversations or the presentations with this team that together everyone achieve more. Thank you.